Good afternoon and welcome to this virtual edition of MedTalks. Today's topic is mindful consumption, alcohol's impacts and alternatives, with a special focus on resources here on the Sunshine Coast. My name is Joanna Puros, coming to you from beautiful downtown Gibsons. I am pleased to be a member of the board of the Sechelt Hospital Foundation and very happy to be part of this conversation today. Support for today's MedTalks has come from our friends and partners at the Sunshine Coast Credit Union and from the Sunshine Coast Foundation. On behalf of the Sechelt Hospital Foundation, we thank the Sechelt Nation for their gift of 11 plus acres of land in 1963 so that a more modern Sechelt Hospital facility could be built to serve all residents of the Sunshine Coast. We acknowledge that we live and work on the unceded homelands of the Sechelt Nation and all First Nations people that call this land home. So why did we choose to focus on alcohol today in this edition of MedTalks? We've heard both anecdotally and through research that the pandemic has not done us any favors when it comes to the consumption of alcohol. We know that a lot of people are drinking more than they used to, and we also know that it's seniors that have been hitting the booze more frequently and in greater amounts. Perhaps this sounds familiar to you. Personally, I know quite a number of people who are really trying to rethink their relationship with alcohol, and if not quitting entirely, or at least looking for ways to moderate and cut back on that. Perhaps you are in the same boat. So before we get started with our panel of experts and your questions and comments, we want to give you a little bit of inspiration to investigate the alternatives. And this little video vignette comes to us from our friends at the Barefoot Gecko in Lower Gibsons.
My name is Andrea, and I am the general manager at the Barefoot Gecko in Lower Gibsons on the Sunshine Coast. We have a few mocktails on our menu that we've had since we opened. It's nice to have an alternative for people who don't drink. I have been sober myself for about a year and a half, and so even when I go to other establishments, I also appreciate having mocktails on the menu so that I don't even have to ask, can you make that non-alcoholic? And just so that it's a more comfortable exchange sometimes for people who don't want to share about not drinking. So the mocktail that we're going to be making today is called a pepino mojito. Pepino in Spanish translates to cucumber in English. Okay, so the ingredients that we need, you'll need mint, cucumber, lime juice, and you'll also need a mint simple syrup. Okay, so the first thing we're going to do is we're going to take a sturdy glass and we're going to take about 3 slices of cucumber. So I'm going to take 2 for the actual beverage and I'm going to leave 1 for garnish. So you're going to drop the cucumber into the glass. You'll take your muddler and you'll give it just pressing down just to release some of that, mostly water, into the glass. And then you're going to take about 3, 4, it really depends on the size of your mint leaves. At this time of the year, the mint is getting smaller. This is more of a summer cocktail drink, but that's okay. So you're also going to give it a smack, and that will release the essence of the mint into the glass. And then with a pressing down and twisting motion, you're going to muddle your mint and cucumber together. Okay. Go. Okay, the next thing we're going to do is we're going to add equal parts fresh squeezed lime juice. So we squeeze our lime juice here in-house. So you do 1 ounce of lime juice, and then you're going to add 1 ounce of mint simple syrup, and that goes in there. You will add ice, and then you're going to shake. Some people don't shake mojitos, some people do. It's about 10 seconds of shaking. Okay, done shaking. Sometimes it gets real wedged on. There we go. Okay. And for this, you're going to double strain. So we have our normal 1 strainer, and then we're going to use another strainer just so we have no floaties. People don't like floaties. There we go. You're going to add your ice. And then you're also going to add soda. There we go. Use a long spoon. Give it a stir. And then to make it fancy, we're going to cut a little slit in the cucumber. And then that's the great thing about mint is that you pick off the big leaves and then you have this pretty little garnish left at the end. So you just insert the garnish. There you are. A straw. And there's your mojito.
That looked amazing. So nice. Thank you, Andrea. As always on MedTalks, we welcome your comments and your questions. Please use the chat feature to put those questions in. We're going to try to go to your questions at around 4:30. So now I'd like to introduce our first guest to crunch some data. Wendy Francis has been the executive director of the Sunshine Coast Foundation since 2017. She's trained in biology and law, and Wendy has worked in the nonprofit sector for the past 25 years. The Sunshine Coast Foundation itself periodically produces a report called Vital Signs, assessments of local well-being based on indicators of community health. And Wendy, we are delighted that the foundation has come on board as a sponsor for today's MedTalks and that you can be with us today. And I just personally, a personal question, why this topic? Why were you so engaged in being involved in this one?
Well, thanks so much, Joanna. We know that during COVID, many people's lives have been disrupted, both socially and economically. And the Sunshine Coast Foundation is supporting these talks because we share the Hospital Foundation and with others a concern about how stress and isolation associated with the pandemic might be contributing to unhealthy drinking habits.
And I know that it's early days to have solid data for us to crunch in terms of the impact of the pandemic. So a lot of it is anecdotal, but you do have some data for us that is fairly revealing. Do you want to run through some of that now from the Vital Signs report?
Yes, I will. Would you like to put the slides up, please? And then you can go right to the next slide, please. So just a little bit about the foundation very quickly. The Sunshine Coast Foundation was founded by concerned residents in 2003. We provide financial support to the many local charities that make our lives here vibrant and welcoming. And we do this by investing the donations we receive and using the returns on those investments to support local charities. Each year, we award hundreds of thousands of dollars in grants, and over time we have provided more than $2 million in local financial support. Next slide, please. There is a national program under the auspices of Community Foundations of Canada called Vital Signs. And the Sunshine Coast publishes Vital Signs, the Sunshine Coast Foundation publishes Vital Signs here locally. And we use information from Statistics Canada and Statistics BC, as well as community surveys to assess the health of the Sunshine Coast. We can track specific indicators to report on how our community is doing, and we look at things, indicators of health and education on our economy, and over time we can see whether these indicators are improving or worsening. So the statistics that I'm going to share with you come from these reports and other sources of verified information. And as Joanna has said, in many cases these predate the pandemic and may not reflect how COVID has contributed to worsening the challenges around alcohol consumption in our community. Next slide, Taryn. We do know that alcohol use is growing among young people in our community. In the most recent survey, which was done in 2019, 56% of students in School District 46 said they had tried alcohol, and this was an increase of almost 4% from the previous survey. And then perhaps of more concern, 6% of local high school students report having an addiction problem. And that was actually double the number who reported addictions 8 years ago. Sunshine Coasters are drinking an average of 2.4 drinks per day, or nearly 17 drinks per week. And since this is an average, many are drinking more than this. And this consumption is above what's recommended by healthcare professionals, which is 10 drinks per week for women and 15 for men. And again, keep in mind that these are pre-COVID figures. Next slide, please, Taryn. There are significant costs associated with the overconsumption of alcohol. We know that in British Columbia, the cost of substance abuse in 2017 was more than $6.6 billion. And the costs associated with alcohol are the most significant of those. And that breaks down to an estimate of nearly $500 for every person in the province due to premature death, increased healthcare costs, lost productivity at work, and costs associated with crime and violence. And we also know these costs are growing rapidly at the rate of 5% per year. Next slide, please. According to the Canadian Institute for Substance Use Research, per capita alcohol consumption tends to follow the strength of the economy. And as our 2020 Vital Exploration report found, the median household income on the Sunshine Coast is lower than nearby communities. And 55% of renters here are spending more than 30% of their income on housing, which is an indicator of unaffordability. Many families here are struggling and their condition worsened during the pandemic. During COVID, local service providers have seen an increase in requests for counseling, requests for housing and rent assistance. In particular, as Joanna mentioned, the number of seniors requesting assistance has increased, and we've seen an increase in the number of individuals requiring emergency food. And all of these factors may exacerbate the stress leading to unhealthy alcohol consumption. Next slide, please, Taryn. We also have data on those living with mental health challenges or who are otherwise vulnerable to isolation and its negative impacts. 36% of seniors on the coast who are 75 or older live alone, and among those 85 years and older, that rises to 46%. We have also seen a local increase in psychiatric clients and among community counseling clients. And again, these figures do not reflect the demand on our local service providers that we are seeing during the pandemic. Isolation, loneliness, and mental illness may all contribute to increased alcohol consumption. And the final slide, please, Taryn. So there is reason for concern for our neighbors who may be drinking more than is healthy due to a number of factors. And I hope I've set the stage for my co-panelists to share some insights into how to manage drinking in a healthy way. Thank you for allowing me to share this information with you.
Thank you very much, Wendy. And you will be around with us a little bit later on in the hour to answer any questions that come in over the thing that really grabs me when you go through that data is how all of these things are so interconnected. And that's a really interesting observation. So before I introduce our medical panel of experts, let's take a quick hop over to Davis Bay for a very brief mocktail demonstration from the porch.
We are doing a mocktail. It is a cocktail without alcohol. It is rosemary simple syrup made in-house. It is pomegranate juice, rosemary sprigs, and pomegranate seeds. And then we're topping it with a nice ginger beer, which is Fenton's. Great for the holidays, great to share with friends, super easy to make, and really tasty. So we're doing an ounce of simple, which is rosemary, fresh from my garden, pomegranate juice, an ounce. We are doing a ½ ounce of lemon. I'm going to give that a big shake. And we are going to strain it into a nice wine glass for the holidays. And you're going to top it with some ginger beer. for garnishes, nice sprig of rosemary, and your pomegranate seeds. And there is your nice fall mocktail.
Thank you so much, Dre. I would now like to introduce our substance use experts, Dr. Simon Resnick and registered nurse Kendra Rose. I'll do those in order. Simon Resnick has been a GP on the Sunshine Coast since finishing residency in 2006. He cares for patients in several different environments, including the office, hospital ward, emergency room, use disorder addictions clinic, and extended care. He's a clinical instructor for UBC's Department of Family Medicine and enjoys being involved in the educational development of our many visiting medical trainees. Simon and his family take advantage of as many of the indoor and outdoor opportunities that the Sunshine Coast has to offer. Kendra Rose has been a registered nurse for the past 15 years, 12 of those providing nursing care to community members who are using substances. Kendra has experience working in several different areas of substance use care, including withdrawal management, oral agonist therapy, and most recently working as a clinical nurse educator for the Regional Addiction Program. Kendra has completed both a Bachelor of Science in Nursing and a Master of Nursing degree, along with completing the BC Centre on Substance Use Addiction Nursing Fellowship in 2018. Kendra continues to work towards and advocate for culturally safe, accessible, trauma-informed, harm reduction-focused care for community members who are using substances. Welcome to both of you. Thank you so much for being here. Dr. Resnick, can we start with you? You see the impacts firsthand in the emergency room. What are you seeing on the Sunshine Coast during this pandemic time?
Thanks for having me. I would say first that I'm not, anecdotally, a lot of my patients in the office and some of them in the emergency department do tell me that they're drinking more, but I'm not sure that things are necessarily worse in the emergency department because I don't have that data. And anecdotally, I'm not sure because we've always seen alcohol and we always see the worst problems of alcohol in the emergency department where people show up in need. And so I think setting the stage in the emergency department and a little bit would be helpful. And lots of people who are watching this have probably been to our emergency department, which is extremely busy, usually staffed with one doctor and a number of nurses. And patients who are coming often have to wait for a while. And there's certainly a lot of involved people with our patients who come in with alcohol. And so there's a lot of challenges involved because emergency room is meant to get people in, fix the problem, and get them out pretty quickly. And that is not the best way to treat alcohol use disorder at all. And sometimes the patients who really need the most help have to be transferred off to another hospital where they get management for a broken bone or something that we can't offer them on the coast, and then they kind of get lost to follow up. And so it's pretty challenging in that way. But certainly we see a lot of people, and we have certainly the obvious people with alcohol use disorder, and those are the people who come in intoxicated, sometimes repeatedly, or who come in and they're ready for change, and they're asking for detox, which we don't have home detox services, and often have to bring people into our hospital to help them get through that period of a week where it can be medically dangerous for them to come off of alcohol if they so wish to. And then there's the not so obvious alcohol use disorder patients who aren't necessarily willing to share with us when we ask them if they're using alcohol, and in particular the elderly person who lives alone at home and has had a fall and broken a bone that doesn't necessarily need surgery right away, or is coming in and is just not doing well. So there's nothing specific going on, but they're losing weight, they're malnourished, they're having stomach problems because of the many effects that alcohol has on their body, and it can take a while for us to figure it out if people aren't necessarily willing to share that because of all the stigma involved with alcohol use disorder. And so it's incredibly challenging to deal with all of those situations and try and help patients get where they want to go, essentially.
And I suppose, would it be fair to say that sometimes we see victims of alcohol who aren't themselves the ones that are drinking?
Absolutely, yeah. I mean, specifically with car accidents, or when you have combined mental health and alcohol use disorder and violence around that, and family members. Certainly the stress of watching one of your family members deteriorate can be incredibly challenging and create mental health problems of their own for family members, of course.
So, Kendra, if I can go to you quickly, a lot of people, when they think about cutting back, well, stopping drinking, all they really know is the Alcohol Anonymous model of complete abstention and the STEP program and all of that. Can you talk to me a little bit about all of those other things that you are involved in?
Yeah, thanks very much. Yeah, so I think really and truly everything that Simon has said is very much true in that acute emergency department. But a lot of people reach out to engage in supports before they reach the emergency department. And traditionally the thought is that abstinence is sort of your only way forward with something like alcohol use disorder. But really, we know that when people engage in any kind of care at any level of use, whether it's cutting back or abstinence or even just reducing the harms that alcohol is impacting in your life, we know that care improves the quality of their life, as well as opens doors to shifting change and supporting people to access medications, support, counseling, things that don't necessarily have to be grounded in abstinence, but in moderation and in harm reduction. So there is a spectrum, and truly what the best case scenario is that person is being reached where they're at, where their goals are centered for themselves, so that it's not prescribed or dictated. It's something that's coming from within and something that somebody is creating in collaboration in some cases, but in creating their own goal set towards what they see as appropriate for their alcohol use.
It wasn't that long ago that I first became aware, through doing some research about this whole notion of oral agonist therapy, that there are actually prescriptions that people can get that will help them through this process. I was absolutely blown away. I had never heard that before. Can you talk a little bit about that whole area?
Yeah, sure. So yeah, there's a couple of approved medications for the treatment of alcohol use disorder. The first line medications that we use, and it is primarily naltrexone, which is an interesting medication. It's actually an oral formulation of Narcan, which we use to reverse opioid overdose. And this medication helps reduce the cravings that individuals feel when they're using alcohol. So really, it helps the brain crave alcohol less, which then helps people cut back on the amount they're drinking, or goals, it could be towards abstinence as well. So naltrexone, and then the other one is acamprosant, and acamprosant is similar to naltrexone, but it works a little bit differently in the body. It's really more for somebody who is trying to cut alcohol out of their life, versus naltrexone is something that a person could use to cut back on their drinking. They could still be consuming some levels of alcohol with it, or it could be used for abstinence, so it's a little bit more flexible. And these medications are they're covered under most healthcare plans. So if you are receiving any kind of healthcare support or pharmaceutical support for medications from the government or from work, these medications are covered under that. And any practitioner, GP or nurse practitioner, can prescribe these medications. So they're quite accessible, and they do really help people find some support with their alcohol use. And it doesn't have to be the white knuckle, just grin and bear it through the withdrawal that we used to sort of think people would have to go through. We don't need to punish people. We can support people in cutting back on their alcohol use or becoming abstinent, whatever, on that spectrum of support.
So it's super helpful to know that option is out there for people. Simon, how well utilized is that amongst other GPs and amongst other physicians?
It's mostly well utilized. So our psychiatry department will see the patients in the hospital when they're admitted, and they use it extensively. Certainly the group of doctors that I work with in addictions, we will use those medications extensively. And some of our colleagues will ask us for advice in those situations, and then they will feel comfortable using them extensively. They are great when they work, but realistically, I feel like there's no one thing that treats alcohol, and there's no one modality that will treat it effectively. So it really does take a family to treat somebody with alcohol use disorder, and the medication would be one building block that we didn't have when I first started practicing years ago, and that's becoming something that we can do in addition to all of the stuff that we previously did, which was counseling and getting support for patients and engaging them in community groups that like AA or Smart Recovery, and even sending them to a residential treatment center. So it's becoming more and more used, but they don't always work, and patients don't always tolerate them because they do have their side effects just like any other medication. And we have to be ready to, as GPs and psychiatrists and healthcare providers, switch from one to another. And there are, even in addition to those two that are approved, at least 3 or 4 other medications that my addiction colleagues will use for alcohol use disorder that are off-label and not as accepted, but sometimes help people.
Kendra, can you speak a little bit to this whole, exactly the point that Simon just raised, that it's not enough just to take the magic pill, but you need to have the counseling support or the communities, whatever. How does that work in your practice?
So I think, again, it's really personal goal driven. So, for some people, the medication is a start and it's something they explore. And then from there, they may look to joining into a support group. I think, the offer of what's available, it needs to be, there for people to choose from. But I really support people having their own say in what works for them. So it can be so different from person to person, what they find and identify with as supportive. For some people, in-person meetings like AA or Smart Recovery are really essential for them to sort of gain they've picked for themselves. For other people, online communities or online chats are very helpful, or using like an app like moderation.org has, or Drinking Coach. There's all sorts of apps out there that people can log their drinking in and sort of track their drinking habits and to support a reduction in that use. So it really depends on the person, but in a long answer, yeah, it's not just the medication. What it is finding what works for you and trying different things to support your end goal, which can vary from abstinence to moderation to reducing the harms that alcohol impacts in your life.
I'd like to ask both of you this question. Do you feel that the problem is becoming bigger, but at the same time we're getting a better handle on it? And divvy that up. Maybe Simon, go to you first.
Good question. Again, like I said at the start, I think it's always been a big problem. I think since alcohol has been around, it's been a big problem. It's kind of portrayed in the media that way. It's certainly, I think we're becoming more facile at understanding that alcohol can also be, and often is, a symptom of a lot of underlying trauma or problems behind the scenes that our patients are having, and starting to help people in those situations again with our groups. Yeah, I can't actually say that it's becoming a bigger problem in that manner. Although if somebody showed me the data that said yes, then I would say, of course, it is. But it's always been an issue.
Right. And so you do feel, though, that there is some light at the end of the tunnel in terms of this oral agonist therapies, in terms of being a little bit more aware of where this is coming from? Would that be correct?
I think we feel more empowered as healthcare providers with more options than we used to have, and you know, it can be a really frustrating thing, and we all as healthcare providers can feel like failures when our patients that we work so hard to take care of, especially in the past, would end up in the emergency room intoxicated or injured or dead from their alcohol use disorder. Whereas now, when we have some tools and ways to engage people and bringing them back in the office and saying, well, this didn't work, let's try this and let's engage you with this problem, provides us more abilities to help patients. And when you have options, one of them often will work, and you know, a portion of our patients are going to get better, which is way more positive and makes you want to try and engage more with your other patients who are having trouble. So when you see some successes, you kind of build on that.
Okay, wonderful. And Kendra, same kind of two questions to you. Are you seeing the problem is maybe getting worse, but we have more potential to deal with it? How do you see it?
I kind of echo what Simon said. You know, I think alcohol use has been well ingrained into our society forever, and it's you know, relatively well accepted in society until it's not, you know. So there's like this fine line that is crossed somewhere in society where you become a drinker or somebody who uses alcohol that's no longer within the norm of what society deems acceptable. But up to that point, you know, binge drinking and celebrating life's events and losses with alcohol is very well accepted in our society. So, you know, I think it's hard to say if it's worse. I think that people under pressure show symptoms of stress in different ways, and alcohol use, along with other substance use, is one of those indicators. So through this time of COVID, I think there's been an increase in a lot of different things, but I don't have the data in front of me to say that I can, you know, pinpoint what those numbers are. But just seeing people's distress and stress in general, it's sort of follows suit that people are trying to find ways to cope. And alcohol is one of those things that can slide in there and provide you with feelings of resilience and coping in times of stress, and then end up being a bit of a slippery slope for folks. So I think we also are in a phase right now where we're really aware of the harms that substances can bring to our communities, especially with the overdose crisis that's ongoing. And so I think healthcare providers and community members are sort of in a space where they're open to talking about the harms from substances, whether it's alcohol or opioids. So I think it's like a motivational time for communities to sort of look towards how we can support each other better and what we can do to decrease harms for our community members that are using substances. So I think it's positive. I think we have a long way to go in being able to destigmatize this, though, because I still think it's shame brought on people who come forward looking for help, and it can feel very vulnerable for individuals to come forward, even to a trusted healthcare provider. So we do have work as a community and a healthcare system in destigmatizing this, so that it's looked at as a chronic health condition like diabetes or heart disease, so people can come forward and be treated and you know that there's accessible treatments that can be provided without feeling shame about it.
The other analogy that popped into my head as you were speaking is what happened with smoking. When smoking was so, I mean, even to the extent that back in the 50s, all the advertisements showed your GP, like Simon, sitting there having a consult with his patient with a cigarette in his hands, and that became completely unacceptable. Do you see it going that way, Kendra?
I don't necessarily know if alcohol will go the same route as smoking. I think we have a bit more ability to target groups like youth and you know, people who have health concerns. But you know, I don't know if anybody, football fans, there's a Super Bowl, this year's Super Bowl, one of the main ads was a Budweiser ad, and it was like broadcast all over you know, North America, whoever watching Super Bowl, around the benefits of drinking alcohol, and it's like this major, funded event. So, I think alcohol is pretty entrenched, and it's complicated around, what's criminalized and what's decriminalized. But I feel like at the end of the day, it's down to the community members to step up and protect each other and talk about it and destigmatize it so that people can get help and not feel that that they're ashamed to come and ask for help, because I think any engagement in healthcare is good engagement.
And Simon, any thoughts on whether or not this will go the way of smoking?
Yeah, I'm with Kendra on this. Because there are so many people who can use alcohol as it's intended, or can use it in moderation and don't have that goal to quit. And because when it's used in moderation, it may not have a lot of health risks associated with it. I don't think it's going to, but yeah, I don't think it's going to.
Okay. I know we have quite a few questions, and you're going to have about a minute and a half to add in some more questions through the chat while we take a quick stop down to Lunitas in Lower Gibsons for another mocktail recipe.
Hi, I'm Stacy. I work at Lunitas here on the Sunshine Coast, and I'm so excited to walk you through a mocktail for this holiday season for any of you that are playing with sobriety, reducing your consumption, or maybe you've been designated the DD. We're gonna show you one of our favorite plays on a margarita without booze. So take a little bit of lime, you're gonna rim half of the rim of your glass. You can use whatever glass you want. We're going full holiday fancy here. Get some nice rock salt. The higher quality the salt, the better. You definitely want a little bit of texture so that it really hugs that rim. That's a nice healthy rim there. If you don't have an alcohol shaker here or a cocktail shaker, feel free to use a mason jar. It won't break, the ice will break down. Make sure you just put the lid on it, give it a shake if you don't have one at home. So the things that you'll need your shaker, your salt, some coconut water for those electrolytes. We're using the Sunshine Coast Olive Oil Company. This is a coconut white balsamic vinegar, some fresh lime juice, and then a little bit of agave. If you don't have agave, honey works. You could also do a keto-friendly syrup with xylitol or monk fruit or any sugar substitute that you have. This year, we've got a 1.5 ounce shot glass. This is what we're gonna be using. So all of the measurements today are gonna be 1.5. So you're gonna go 1.5 ounces of coconut water, 1.5 ounces of fresh lime juice. Give yourself maybe 1/2 ounce of sweetener, 1, 2, 3, 4, 5, 6, 7. And then a splash of whatever balsamic you like, but I really recommend the coconut. This glass is pretty small, so we're not gonna use a ton of ice, just a little bit. Pop that on. And the magic is in the shake. And of course, because we like a little Mexican touch, a little bit of dried lime on the edge. There you have it. Happy holidays.
Sorry, my bad. It happens all the time. What I was saying is that all of those recipes will live on our website so that you'll be able to go back and make them for yourself. Time now to bring in Jane Macdonald, who is the Executive Director of the Sechelt Hospital Foundation. And Jane has been curating the chat and pulling out the questions for our panelists. Jane, over to you, my dear.
Hi, everyone, and greetings from the Sechelt Hospital Foundation here at Sechelt Hospital. So grateful to our entire panel for making yourselves available for today's lively discussion. And we've had a few questions from all directions, from staff and as well from a few of our visitors today. So a question regarding problem drinking. Kendra or Simon, could you answer the question of how much is too much for women or for men, and even for people who have a family history or genetic predisposition to addiction?
So I think there's some guidelines that have been published for low risk drinking from Health Canada, and it's less than 10 drinks per week for women, 10 or less drinks for 10 weeks, for women, and 15 for men. And keeping in mind that can be considered high for some people, depending on your lifestyle and your health, sort of what your other outlying health is. But I think what's important to remember is trying to delay drinking, matching if you're out having alcoholic beverages that you want to be eating, that you want to be sure that, you're spacing your drinks out. You're not drinking every day, because alcohol is something that is habit forming. So, daily drinking can take its toll with forming that habit. So I think, people drink more and less of that, and may not be considered that they're having any kind of struggle with alcohol use. So I think it really comes down to what the other indicators are in your life. Are you having struggles at work? Are you having struggles with your family? Are there people that are concerned? Do you have concerns? Have you had incidents where you've arrived in hospital with bad health outcomes because of alcohol, or breakdown in relationships because of alcohol? So I mean, that goes a long way to telling whether your drinking is becoming something that's becoming problematic for you. So that's my take on it. Simon, did you have any other thoughts?
I totally agree. I often in the office and sometimes in the emergency room will bring up the PDF online and just go through it with patients, and you create an externalized guidance, so it's not directly from you. There's not a lot of judgment in that fashion. What Kendra kind of hinted at is for men, it's no more than 3 drinks at a time, and for women, it's no more than 2 drinks at a time. And those skip days are really important, just to echo that. But Kendra's absolutely right. Is those numbers are kind of numbers, and I use them, but it's when alcohol, simply put, has an effect on somebody's life other than just having a drink and relaxing. That's when we start to say, hey, this might be a problem, and that deserves some exploration between us and our patients. So.
Thank you. Another question, just can you explain some of the impacts of alcohol and incidents of cancer and even heart and stroke disease? Like, how are the two connected?
So on the whole, we just, I had to look it up because I don't often deal with that specific question, but it appears that alcohol can double the rates of many cancers, including oral cancers, esophagus and stomach cancers, bowel cancers, breast cancer, and causation is pretty difficult to nail down. But people who drink more tend to have that associated increased cancer. It may not be that alcohol is actually causing it, but it might be other things that are linked with people who drink more alcohol. Who knows? We don't really know that. And then certainly cardiovascular disease, again, when I started practice, or before that even, it was drink a glass of wine to protect your heart every day. But we do know that people who excessively drink alcohol typically can have wide variations in their blood pressure, which can lead to end organ damage, we call it, or basically your organs can be affected, and heart attacks, strokes, kidney damage, all can happen from that. So there's definitely seems to be a link there for people.
I think too, I just want to speak to the mental health piece too. So I think alcohol is a really good pretender, and it can, like I said before, make you feel like you're being soothed, or that it's making things better in the moment. But it really has a huge part to play in increasing anxiety and depression, and worsening the symptoms of anxiety and depression. So I just wanted to point out that physical health, but also mental health is impacted.
Totally.
Very much so. Here's a question. If you believe your spouse or partner is abusing alcohol, but they deny it, what is your best next step to encourage him or her to get help or at least recognize the problem? What guidance could you provide folks that are dealing with alcohol in their families?
That is a tough one. I'll tell you some experiences I've had, which are helpful to me as a GP. So sometimes you just hit a roadblock. We hit roadblocks with patients that just aren't there yet to accept that. I appreciate as a family doctor if a family member alerts me to something. And so you can always talk to your partner's doctor and just say, we can't share information back about that patient, but we can certainly accept information and then somehow bring it up with our patients in the office in a non-judgmental or other fashion. Sometimes we can find different hints that the alcohol is causing them a problem and convince them of that. And Al-Anon is a great resource for family members, and I think they're going to be better than any advice that I can give about how to approach our family members who use alcohol and are in denial about it, or where you're just not able to approach them about it because it's so difficult. And they'll have tricks and tips that they've used to do that that I don't necessarily have experience with.
There's a question regarding fetal alcohol syndrome and how much can an expecting mom drink and not harm their baby's future development? Where can young parents go for help if they're worried about their child's development after they've been born?
I think I can answer that one too. So I think the reason that we say, and I support this, that pregnant women should not be drinking alcohol is mainly because there's no good way to find out if there is a safe amount. It would be morally wrong to take 100 moms that are pregnant and divide them up into groups and give the moms smaller or more amounts of alcohol and try and figure it out. So the easiest answer is probably not to drink during pregnancy. And it makes a lot of sense to me because everybody's going to have different tolerance, and you have a developing cells in your body and they can all be affected by alcohol. So it is a good recommendation, and certainly that's my recommendation, and all of the associations that are medical associations that speak in and chime in about that. So 0 because we don't know, and once the baby has been born, if there are concerns about that, certainly your family doctor is a good starting point, because we are the people who can refer you on to the teams of specialists that help our patients with fetal alcohol syndrome. Pediatricians and developmental pediatricians mainly, for sure.
Kendra, you mentioned, maybe it was Simon who mentioned the first steps of addressing trauma and actually why people drink excessively. Are there any resources or steps that you could recommend if someone is trying to figure out sort of what's going on in their lives and why certain things might be going a certain way and why they're depending on alcohol? How to start to have that conversation to get help regarding trauma that might be leading to all of this? Where would they go?
I think that's something that you want to work with a professional who is skilled in that trauma response. And so, locally here on the Sunshine Coast, we have the mental health and substance use building on the Sechelt Hospital grounds. And so they do have counseling services there that are skilled in working with people who have trauma in their life. Sometimes the work is more around grounding the person to be able to sort of manage some of the stress that they're in so that they can down the road look at the past stuff that's impacted their life. So sometimes it's not just about coming in and saying, I have had a traumatic experience or have had past trauma. It's about, sort of grounding the person in what's happening now and sort of working through settling them so that they can sort of pursue getting well again. And then I think the other piece is support with family members and other individuals in your life that like friends. You can find support in a lot of different ways. It doesn't have to be an official counseling service. It can be, meditation. It can be through physical exercise. There's all sorts of ways to reground yourself. But really, truly, that true trauma work is something that you would work through with a professional.
We just got one in from the audience. What are some of the biggest myths that keep people in shame so that they don't seek help?
I think the stigma piece is the biggest overarching hindrance or barrier for people to access care. Like I said before, there's a fine line where drinking socially is accepted in society, and then there's a line there that people maybe don't even know they've crossed over until it's quite advanced, that you're no longer accepted in the way that you're drinking. So I think at the best of times, we have to approach everybody with kindness and awareness that, that they're here to get help, and open doors instead of close them. So as healthcare providers, that's our work that we need to do, is to, somebody coming and presenting in say my office, who says they're not quite ready to stop drinking, but they recognize that things aren't going so well for them, that there's no judgment in them not being 100% ready for abstinence, because that's not something that we have to do. We can talk about cutting back. We can talk about safety in your drinking. We can talk about ways to improve your health. And all of that is not anything to be ashamed about. That is something to be, quite honorable. And if you ask me, because it's a position that you're in, that you're asking for help, and you feel quite vulnerable when you're doing that. So I think stigma is a really huge piece of this work that needs to be looked at, so that people don't feel ashamed.
The biggest myth that I hear is that it's a matter of willpower, and I hear that in all of the realms of addiction, from the patients who have addiction problems with opiates and with non-opiates and alcohol, because the leading theories and what sits well with me after being involved in this in the last several years is that it's not a willpower problem. There is a brain chemistry problem, or things that have internally changed since people have started using whatever they're using problem, and those things are as hard to fight as hunger, and sex drive and all of that stuff, and those are very hard things to beat, as many of us know, and they're not there to beat on your own. You need a number of people around you supporting you to do it better.
Thank you. Okay, last question here. How to be sober curious without being a party pariah? What script or words of advice do you have for helping us navigate the holiday season and peer pressures? How to avoid offending a host who wants everyone to have a good time? I'd love to hear from the whole panel. Like, what do you say when you say thanks anyway, or I'd like to have one of these mocktails?
I'm going to jump in and say it seems counterintuitive that the shame is now in being a non-drinker. In some environments, this is a conversation I had with a number of friends about a week ago, and we were all practicing not drinking and talking about how some people feel really awkward and they have to make up an excuse, like I'm on antibiotics or something, and they don't feel comfortable just coming out and saying, you know what, I'm not drinking right now. It's funny that we're at that point of where it's shameful to not be participating. Is that weird?
I think it's just that piece of alcohol is used for celebration in our society, and it's looked at as a social lubricant, and people are like, you want to unwind and have a glass of whatever. So working with clients that have just said, I don't know what to say. There's all sorts of things that, you can do. You can just be open and just say, I'm not drinking right now. Or you can say, I'm allergic, whatever. Like, it doesn't, you don't really have to give a definite reason. It should be just enough to say, thank you, from bringing your own non-alcoholic drinks to the party to, there's all sorts of different things that you can do. Going with somebody that's also not drinking, or letting the host know beforehand that you're not drinking and that, I'm going to be providing my own non-alcoholic beverages. So I don't know. I think people are pretty open. There's a whole bunch of people who are famous and, on Instagram and all that kind of stuff that are really open about their abstinence from alcohol and their choices about not engaging in substance use. So I think more and more it's becoming common that you aren't the downer, that if you're choosing not to engage in alcohol. So it's sort of looked at as a health choice or, a life choice. People have made these decisions to stay away from substances for all sorts of different reasons. So I think it is shifting and can be quite positive.
All right, folks. Well, I believe we've put a few different references on our website next to the MedTalk post, just for guides on mindful consumption, and as well as some local references for where to go and get help if you need it. And I think it's my duty to introduce the next mocktail recipe, and this is from El Segundo, I believe. Thank you.
I'm Violette. I'm the bar manager here at El Segundo. Today I'm going to show you one of our most popular mocktails called East is That Way. So first you're going to start off with adding ice to your glass. Then we're going to add 1 ounce of lime juice, 2 ounces of pineapple juice, 3/4 of an ounce of our house-made cinnamon cardamom syrup, 1 dash of the Bittered Sling Len Marrakesh bitters. And we're going to top it with soda, approximately 3 ounces of soda. Give it a little stir. A little bit of nutmeg on top. And fresh sprig of mint. And there you go. East is that way. Cheers.
Fabulous, fabulous. Thank you so much. Thank you, Wendy from the Sunshine Coast Foundation. Thank you, Dr. Simon Resnick. Thank you, Kendra Rose. Thank you, Jane, for fielding all the questions. And I think it's becoming clear, just those little video inserts show you how mainstream this whole idea is. So if you are wanting to cut back, there's absolutely no reason to feel embarrassed about it. These things are on menus from all of our favorite local people, which means I think that we are seeing a trend where we're taking it more seriously. So we really appreciate this. We thank you very much for tuning in today. Please get in touch with us. Go through the website, send us an email, tell us what you would like to hear about next, what you would like to discuss next on MedTalks, and we will be more than happy to pursue that and pull it all together. So thank you again to everyone, and we will be in touch real soon. Bye for now.